Hi everybody, my name is Dr. Steve Hoffman, and the reason I'm here with you today is to go over 3 things real quickly. I want to talk to you about what MC2 is, why MC2 is important to you, and how you would best benefit from learning more about MC2. MC2 is a physiology-based technique that takes into consideration the idea that it's a nervous system dysfunction that causes a muscle imbalance in the body that produces the vertebral subluxation that chiropractors have always been chasing after. MC2 is more interested in why the bone out of place exists than the bone out of place itself. When we have nervous system dysfunction, it creates imbalances throughout the body. MC2 is designed to, as quickly as possible, as easily as possible, restore balance to the system so that the system can operate as effectively, efficiently, and elegantly as possible. The reason that should be important to you is by doing as little to people as possible and producing as much of a result for them as possible, it reduces wear and tear on your body, allowing you to stay in the game long term, and at the same time will increase the results that you get in practice. And I need you to imagine what your public will think when you do less but accomplish more. How it all works is by figuring out where the dural stress is on the system and what the most efficient, effective, and elegant means of addressing it is. Adjustments can take a long time or a very short amount of time. In MC2, typically adjustments take very little time with very little effort, yet produce dramatic results. So here's how MC2 works. On a typical visit, the first thing we do is assess the upper cervical area to determine if it needs to be adjusted, and if so, in what way. Once we take the upper cervical piece of the equation out of the picture, we then have a prone assessment. And the prone assessment is largely based on, is the tension in the dura in a horizontal or torsional direction, or is it a flexion extension or vertical distortion of the dura? That tells us what the most appropriate corrective vector would be for that individual, and then based on areas of dural attachment, the 3 transition zones in the dorsal spine, we have a very clean, clear picture of where to go, what direction to go in, and what the torque direction would be. As a result, MC2 is perfectly marriageable with literally every other technique out there. You don't have to give up what you do to do MC2. So if I piqued your interest, why not come play? Find out more on chiropracticmastery.com, on our Facebook page, Chiropractic Mastery, and ask for admission to the MC2 Technic forum, also on Facebook. I look forward to seeing you soon.